I'm Dr. John. I'm from Mount Elizabeth Medical Center. I'm an ENT surgeon there, and my main area of interest in ear, nose and throat is in the nose and sinuses, which I've had a special interest and I've gone for advanced training in. Chronic sinusitis is when you have symptoms of sinusitis that's been there for more than 3 months or 90 days. So basically, where you differentiate acute from chronic is the length of time. The symptoms of sinusitis primarily are blocked nose, nasal discharge, which can be from the front or from the back when it's called postnasal drip or catarrh. It also presents with headaches in the acute setting, as well as loss of sense of smell. When these symptoms persist and there are other associated symptoms started coming out, like sore throat, cough, ear block, ear ache, and throat irritation, and it persists for more than 3 months, then we call it chronic. In Singapore, chronic sinusitis is estimated to affect between 14 to 16% of the population. For normal sinus function, we need to have ventilation of the sinuses. The ventilation will also ensure for drainage of the sinuses. So when you have a situation of inflammation, the lining of the nose and the sinuses gets swollen and you don't have normal ventilation and drainage. Then you have a situation of sinusitis. A number of studies have shown that the disability of sinusitis is significant. It's just below chronic rheumatism and arthritis. And it impacts the patient's quality of life significantly in that he may not be able to smell, for example. You may give him a chronic headache. It may affect his sleep, and he wakes up feeling tired. Besides, in some instances, affecting the sleeping quality of his partner with snoring. When the patient presents to me with symptoms of sinusitis, I will look into his medical treatment, which most cases have been initiated by his primary care physician. I will look at the drugs that he is taking, in particular the topical medications as well as the oral systemic medications, and see if there's any way I can improve on that. Once I'm convinced that he's taking the best there is, and despite that he's still not better, I will then consider offering him a surgical procedure. The surgical procedure of basically 2 types. What is practiced commonly now is known as endoscopic sinus surgery, where we put a telescope into the patient's nose and specialized instruments to open up the nasal passages at the same time as opening up the sinus passages. A more targeted approach, which is the second approach which I will also offer the patient, is to use the balloon sinuplasty apparatus. The balloon sinuplasty technology can be compared to the instrumentation that they use to widen the blood vessels of our heart when patients are suffering from heart disease, ischemic heart disease, when there's not enough blood flow to the heart. So they widen it. The balloon sinuplasty procedure is done using the balloon apparatus, which is passed through the nose and from the nose into the sinuses. To visualize this whole procedure, we use telescopes at the same time as using the balloon apparatus. The balloon apparatus is used to widen the opening of the sinuses or the ostia, and thereby restoring sinus ventilation and drainage. The procedure is done under general anesthesia, and it's done as a day case where the patient is admitted on the same day of the surgery and discharged about 4 to 5 hours after the surgery. Soon after the balloon sinuplasty procedures, the patient described themselves feeling a lot better, with ability to breathe restored, headaches gone, sense of smell restored, and able to sleep soundly. A lot of them also described the fact that they didn't have as much discomfort as what they imagined from talking to their friends and relatives who have had sinus surgery in the past. The demanding life of a young executive in Singapore determines that the time away from work after a surgical procedure is kept to a minimum. The balloon sinuplasty technology allows me to do this. Time away from the work is kept to the minimum, and the patient has less discomfort or pain and is able to function better, faster after the procedure.